A pleasant good morning to you, all my people. I hope that we are doing well amidst, the challenges that faces us day by day. One thing that we do know that we are trusting Almighty God because no storm will last forever, and we have to believe that God is able. He said He's able to do exceedingly abundantly above that which we may think or even ask of Him. And this morning, I'm here again sharing my concern with the medical institution in Jamaica and where children on a whole is concerned, the care and the well-being. So I've shared a few days ago of my granddaughter being in the hospital with a broken limb. Now, um, her leg was broken, the femur bone. Most people don't know where the femur bone is found from the leg to up to the thigh. So the bone that connects from there to up to the thigh. The hip, sorry, is that where it is broken. Now, before she has shared that, before she had done the surgery, because she had to do a surgery, she could sit up and all of that amidst the pain and discomfort. When she did the surgery, they had put on the cast, so she was restricted. They call it, I don't remember if they call it this jacket. So her right foot is where the broken femur bone is. So only her toe is left out. It come up to her waist, go across and halfway on the left foot. And only her private area is left out where she can defecate or urinate. Now she is restricted to lie down. So most, she can raise up her head and whatever on her elbow, but she can't sit up. Now I really want to know what is happening in the health sector, because if the government is training people to take care of those that are not well and it's their profession, I think that they should be doing what is they are supposed to do. And I talk also about the ward assistant. They call themselves now the patient care assistant, but I don't see where they are doing that. And I think, closer look need to be placed there. Being restricted, my daughter has to go there every morning. It's very rare since she's there. I think today it might be 20, 21 days since she's there. And the surgery was done like she went to get admitted the Thursday. She went the Wednesday night, got admitted the Thursday. So Thursday, the Monday after that, she did the surgery. um, the care and well-being of these children aren't good any at all. I don't know if there's anybody else who have that experience. My daughter would go there 3 times a day. I have to go in the evening with her, so I would go in when we went there in the evening. I would be the one who goes in, tidy her, feed her with her food and stuff like that. Sit and chit chat with her to keep her company for they are in the hospital. Now, whenever we left there, then it's really hard for her. Whenever she calls help from the nurses or whoever is there, nobody pays her any attention. So because of that, the cast that was placed on her becomes soaked with urination because she can't move to do anything. No, it gets so concerning and get us worried. Leading up to I went there Saturday. When I saw the condition of the cast, my stomach moved within me. It was soaked with urine until the back of the cast was black. And everything within me shifted, because I don't think a human being, a child who have never experienced this before, should be going. And each time when you go, I said to my daughter, you need to talk out about this thing. You're going there, let them know how you feel. You're not trying to disrespect anybody. So when she was talking, somebody came in and said that she's not calling for help. And she said, yes, I'm calling because most time when she's calling for help, she's on the phone with either me or her mother. And they claim that she's not calling. And lying down in urine, it is very uncomfortable. They do not think that a child, as I said, my granddaughter is an outspoken person, so she will question you. She will ask you what you're doing. She want to get all the information that is needed, and calling and no help. I went there and I mentioned this one day, and she was soaking wet. A little blanket was under her bottom, and the bedspread and everything wet, her clothes, but she couldn't feel it because she had on the cast. And it was so heartrending. So when the doctor came on Friday, my daughter spoke to the doctor and they said, all right, they are going to get the cast changed on Monday. That's yesterday. So um fast forward, if she want a drink, we have to put anything that she need after we left there in the morning. After we left there like about 12, 1 o'clock, we have to put it on the bed behind her pillow that she can reach for it when she wants it. The sister came last week one morning and she said to the mother, buy a female urinal, the little jug that the men normally use, but they have the female one now. So you just rest it on the vagina and they'll pee in it and it go down in it, no spill. She bought it and she took it there. She explained to her daughter how it should be used. So when she called and they went there, most of them said they don't know how to use it even, and they say it's a male thing. The female is written on it. And it's like they are ignoring whatever the child is saying. When a child has gone through a traumatic moment and you think care would be there, then the care away from home is not good. And sometimes people bash you going to the private institution if you have your money, and when they end up back at the hospital, no, excuse me. No, I think, and I supposed to think that, people are trained to do their job. And I'm there. I'm not talking about any second-hand news. I'm there one night with her, and one of the patient care was cursing some indecent language on the ward. And she was so upset because she has changed her child and the child messed up, the child can't move. And they called her back to do it and they cussed nothing but some bad word. And I was saying to myself, my God, we are dealing with children here. Yeah, children mess up when we are at home and we, spill things and we slap them and whatever. But when a child is not well and that happens, you know that the child need help. And one night, I remember I wanted to change her, and it was a nurse who assisted me in doing that. So I told my daughter that just don't go and see the situation and no talk. So talk about it. So each time she talk about it, there's like they have meeting and the message goes around. You know what touched my heart to know, people, doing this part too? Because I'm going to allow her to share behind the camera of the things that she had gone through there. She won Friday night. It was Friday night, yes. Friday night, she called and said, tell her mommy that she want to sleep, but she's wet. She needs to be changed, and she's calling and nobody's paying her attention. She said after she called, a lady came in with a young baby in a gray suit. I don't know if it's a doctor. And took up a pampers and give her and tell her to change herself. Now, a child that is restricted, she's 9 years old, is restricted to lie down. How can that child turn out? And we couldn't sleep. And she fall asleep. Her mother said, all right, go get some sleep. And she fall asleep and wake up and said, mommy, I'm so uncomfortable. Because the car is soaked now, so she's feeling the effect of all the wetness. And oh Lord, about 2 hours after they came and they removed that wet pampers and they pushed one under her bottom and they didn't even open the pampers. They just slide it under her without opening the pampers. So when her mother went there Saturday morning, the pampers weren't, she was saying, boy, it's a good thing she never passed her urine. Else she would have more soaking with. And we were praying, wanting Monday to come. And, Saturday when I went there, my heart was broken. Because she has never experienced that. She's sick, we take her to the doctor, she gets well. But experiencing this situation for a child is going to traumatize the child. It reached to a stage now because she usually vomit up the medication because she doesn't like the taste of one. And we have to talk her until she's coping much better in taking the medication. So what they do, the nurse, when they came with the medication, are going to give her medication, they bring in the syringes and give it to her and tell that she's supposed to take it for herself and walk out. Tell me, people, tell me. If I am saying something that, may I put too much. I don't think I'm putting too much. It's your job. And your job is to take care of. And I'm not talking about whatever. I remember one Saturday night I was there. And while I was there, I just can't imagine, because the persons who should be knowing better are doing better, aren't doing better. And I'm wondering, where is the training that you have received when you walk into that profession? Yes, I'm not saying that sometimes you're not burn out or whatever, but if your child not calling you all the while, only when the pampers to be changed, why you not change it? You understand? Yesterday she had to change it. She had to go back to another government hospital to get it changed. And the nurse was saying to her that she can't see how she in a this pampers are full of acid and her skin will start break out. Come on. Come on. Right? So now she had to change it, and we had asked for the doctor to, discharge her, that she can come home where we can take care of her. She'll go to her regular clinic. But people, man, the system is a mess. When adult complain, and if a child is feeling pain, the child, though they cry and they scream and they whatever, because they might feel pain. Adult feel pain and they behave bad. They scream and they shout out much more a child who have never encountered a broken bone and has to be restricted. Come on, people, man. Look at it. Look at it. I would love to know if their children, find themselves in those mess, if they would allow them to stay there all day or neglect their call. I am wondering, because a child calls when that child needs help. The system needs to be looked at. It needs to be looked at. Because if you think you can manage, ask volunteer to come in on a daily basis to assist with the care of the babies that you are there. Ask for people who's willing, mothers, grandmothers, who have time that they can come in like 2 times a week or 3 times a week to assist with the care. A sheet was hung on her bed, the rail on her bed, for 5, I think yesterday would be 6 days. They come to change it and nobody. They are the one that allow the cats to be looking like that and smelling like that. So they refuse to change even the bed linen. They hang it there because they are not going to encounter the smell of the cars that has soaked up the urine. Come on, people, man. What is happening to our health sector? What is happening to our health workers? And I believe if there's superior there, you're sitting around the nurse and the nurse hear you say that, say, no, man, you need to move to go to your job. A suggestion was made by one of the nurse to the doctor to put in the catheter bag. And the doctor said, no, I'm not going to do that. She's a child and she come in with broke foot. I'm going to send her out back with anything else. The doctor said, no, I am not going to ruin her kidneys and her bladder because she come in with broken foot. So if that doctor had not rebuked her and she knew the danger, but because they do not want to do whatever they need, they are there and they are paid to do, they are making reference to do something that is not good. When a child is traumatized by an incident and I am there and a nurse came in to give the medication, she walks in the room, call the child name. Me not in this today, you know. So make sure say you don't take your medication now, because if you don't take it, me now come back in here, you know. I done with you for the day. Tell me if that is right. I am there sitting. Not even if you say, The grandmother is there, so let me go in and be nice. You know, so and so, Jane Brown, this is your medication. I know you don't like the taste of one, but you have to take it in order for you to get well and all of that. The way how she come in aggressive to the child, and I am sitting right there. The doctor came and she realized that the incopod needs changing and whatever and all of that. And she was talking to one of the patient care, so-called patient care assistant to go get one. And she was standing there talking back to the doctor as if, have no right to tell me now go for nothing and the behavior. And it lead up that they were there waiting until the doctor has to cut one of the pampers and push it between her and the cast because of the way of the cast. You tell me something, people. Is this what Jamaica is breathing? Is this what we are voting for? Is this what we are putting up the government for to do? To mistreat us when we go to the health facility? To mistreat when they need medical care? They go overseas. It's hardly that one of the politicians or any one of them that is sick stay in Jamaica for health care. They go overseas. So if the health system was good here, would they travel overseas to get medical help? I don't think so. Most of the time they go overseas for treatment. And I think it's full time we get the service that we are paying for. Paying taxes to pay the workers, it is full time. It is high time that the system step up. It is too bad. And it is reflecting on every child that went there for care. They receive the full blunt of everything, which they have not done nothing. And they are there to heal and to recuperate. And it's like they are so traumatized that you have to be comforting them, anxiety taking over them. You have to be there comforting, reassuring them that it's going to be okay. People, come on. I think we need to do better. I think the health facility need to treat children much better than how they have been treated. Today I rest my case. I'll be back with part 3.